Welcome back to our ECG learning series, and in this video we will talk about Osborn waves or J waves. But before talking about the J waves, we should know what is the J point. So the J point is a point that it's located at the end of the QRS complex and before the onset of the ST segment. So if we want to look at this EKG that is normal EKG here, we can see that there is an R wave, and after that there is an S wave. And at this point here, the QRS complex ends and the ST segment starts. So this point is a normal physiological point called J point. So it is present, this J point is present in all ECGs, regardless of the shape of the QRS complex. And it represents the end of depolarization. And we remember that depolarization is presented on the ECG as a QRS complex. And so this J point presents the end of depolarization and the beginning of repolarization. So again, this J point will be found in all EKGs regardless of the QRS complex shape. As we can see here, again, there is ST segment depression, but the J point should be here, okay? And one more time, if we have ST segments elevation, the same thing. We still have this point here, which is at the end of depolarization and the beginning of repolarization. This is a normal point, okay? Now, what is the J wave? The J wave is actually a positive deflection seen at the J point. So it's a very small deflection that is found right after the J point. So if we can look here, we have, let me just clear everything. Okay, we have the J point here, and after that, we have a small positive deflection just after the J point. This is called Osborn wave or the J wave. Osborn is actually the name of the scientist who initially described it. So we usually go with the J wave. Okay, typically seen, the J wave is most likely to be seen in cases of hypothermia. And for the hypothermia to cause the J wave, usually the temperature will be less than 30 Celsius. And just remember that this J wave is not pathognomic. You can't diagnose that, oh, this patient has hypothermia just because of the J wave. But the Osborn wave is thought to be the most specific sign on EKGs for patients with hypothermia, because patients with hypothermia can present with bradycardia, QT interval prolongation, and some supraventricular tachycardias. But the most specific one of all these findings is the J wave. And it's thought to be the height of the J wave is roughly proportional to the degree of hypothermia. The more the patient is hypothermic, the larger and the taller the J wave will be. Okay. And just remember that there are too many other causes of non-hypothermic Osborn wave. Like Osborn wave is seen as hypothermia, but can be seen with multiple other comorbidities, just like hypercalcemia, sometimes will have Osborn wave, acute myocardial ischemia, especially if it is if it's STEMI, and Takotsubo cardiomyopathy, in which there is like ballooning of the heart. Sometimes it is normal variant. Some people will have this Osborn wave just normally. And sometimes we see it with subarachnoid hemorrhage or other brain injury. It can be seen also with myocarditis, especially if it is severe myocarditis and the patient is hospitalized for. Sometimes we see it in cases of Brugada syndrome as well. So the Osborn wave is actually seen in multiple causes, but whenever you see it, please think about hypothermia as the most important cause. And there is another example here. We can see that here is the J point, and there is a small positive deflection right after that. That is really the Osborn wave or the J wave. And that's it for the J wave. Thank you.